All right, a very good afternoon to all of you from wherever you are. I want to make a very calculated guess that everybody is fine and they won't be here. It is very interesting days, and that's quote unquote interesting because of the times in which we live. But I have grown up to understand that challenges can also be seen as opportunities, depending on whether you were raised as an optimist or as a pessimist. But of course, the nature of world we are, some professions are crafted as opportunities out of challenges, and the medical profession happens to be one of those. It is an opportunity for people to offer care because some have of a malady or disease. As we all know, or may not know, has the health and care worker, and here and health outcomes depending on the availability, accessibility, and capacity of health and care workers to deliver quality, people-centered, integrated care. I like the sound of that. When you hold, I come from the background of theology, so I know that I carry sin, and I am at any one point potentially a patient, even though I invest quite a bunch of time in exercise, as Dr. Bond may know already. But this, of course, is in line with the theme for the Universal Healthcare Coverage Day for 2021, leveraging no leaving and leveraging no one being left behind. Healthcare professional students across Africa are coming together. And of course, they have this afternoon under the auspices of Patient-Centered Care Movement Africa. That took me a bunch to get straight so that I don't end up with a patient with a bitten tongue. But I congratulate myself. Now I can say cleanly that Patient-Centered Care Movement Africa, or PaCeM or PaCeM, depending on how you started English, Afro, to embrace and contribute to the journey. And I think many of you have a concept note, so I won't dwell too much on that. So basically, we're here for that launch. And in terms of purposes, we are aiming to raise awareness, mobilize membership and support for patient-centered care movements for the next generation of healthcare workers across Africa. This is very, very particular for Uganda. As you may know, we are going through a second wave of COVID-19, and some of the conversations here have been on what happens when you go into a hospital with COVID-19, then you die and you leave huge tens of thousands of dollars of bills. So the medical profession, in a sense, is under scrutiny. My name, as has been noted, is Samson Kasumba. I sort of scatter some time on air here, but I am a part-time husband and a full-time father. Reasons for that is certainly a very different conversation, but I want to take the privilege, honor, and opportunity to invite Dr. Bonaventure, who is the Regional Director of Strategy and Innovation, Seed Global Health, who have brought us together. I'll give him 15 minutes. If he takes less, I'll certainly appreciate that, to kick us off in what has been designated as opening remarks, and certainly not a defense of a PhD, at least not this afternoon. Doc.
Thank you so much for the very kind words, Mr. Samson Kasumba. And thank you all our guests this morning, afternoon, depending on where you're calling in from, and our dear panelists who are joining us, and I will have a moment to acknowledge them individually. Honorable ministers joining us this morning, deans, vice chancellors of different universities and higher institutions from across Africa, some as panelists and some as participants, and your excellencies, presidents of students associations and federations of interdenominational, interprofessional associations of students. Panelists participants, ladies and gentlemen, thank you so much for taking off time this morning, this afternoon, to join this very important moment, which is a milestone. It's a beginning of a long journey, and it's also, in many ways, a marker or a recognition of a long path that has led us until this point. With that, ladies and gentlemen, my role this morning will be a simple one. I'll give you a little bit of context to this conversation, and also use this opportunity to recognize a number of people that are supporting this movement this far and going forward. Ladies and gentlemen, this is a special moment in time. This is a special moment in Kairos time. We are faced with a pandemic of unprecedented magnitude. We've seen everything that we've built for so many years being put to the test by this current pandemic. And to have our youth, our future leaders, our future health workers champion a cause that will take the ownership of patient care back to where it belongs, in the hands of the patient, is in many ways a sign of resilience, a sign of recovery, bouncing back and bouncing stronger. We are not yielding or conceding defeat to the onslaught of this pandemic, but we're actually picking the lessons and emerging bigger and better. So I must in many ways congratulate you, not necessarily for picking this moment to launch this, but for finding the opportunity in this moment that in many ways seems like doom and gloom. I fear to open some WhatsApp groups, because usually the last message will be rest in peace, and you're not so sure who has died. So you have to scroll back 50, 40 messages to see if it's one person, two people, and who exactly it is. And it's not a very good point in time, but at least there's a silver lining on this cloud. We're seeing an opportunity to learn lessons from here and take it forward stronger. Further to that, also the pressures, lack of protective equipment, overwhelming numbers of patients, the unprecedented pressures that have come with the sheer numbers and severity of cases that we see with COVID have made us to rethink or to lose some of the things that actually matter. And we all know that every chain breaks at its weakest link. And unfortunately for this particular time, when we've seen COVID treatment units, isolation units, that weak link has been communication, explaining, using of information rationally, and keeping patients dignified and a part of this whole journey amidst this challenge. And that is truly what patient-centered care is. That the patient is supposed to, the care provider is supposed to give the patient enough information for the patient to make a decision, but many a time we end up having the patient giving the care provider information for the care provider to make the decision, which is not right. You know, many times you move out of home and go to hospital because you know what you want from hospital. You want to get better, or you want to feel dignified, or sometimes you know that what you have is not going to go away, but you just want someone to acknowledge it. And then you celebrate that day, thanking God or goodness that you're at least able to be alive. I want to acknowledge that this moment in time where we're seeing the future generation rising up to start a very noble cause is not unprecedented. We've seen some of the major discoveries in science. Warfarin, which is a magic drug that treats clots. Insulin, which is a lifeline for people with diabetes. All these are things that have come from students. They were not discovered by university professors. But even then, a number of other movements, bringing people together to make a difference, have been ideas that were championed by people who were still in formation. And I think to have students champion this and say, look here, we need to return the power of patient care to where it belongs, is a challenge for everyone, not just students, but all of us where we belong, not just in the healthcare, but elsewhere, to say, I have the power because it's bestowed upon me by an office, by a mandate, but there's someone who truly deserves this power. I'm not making any insinuations on politics. I don't want to be quoted on that, but I'm saying there's a lesson to learn from here, not just for healthcare, but also other pieces. The one milestone that I wanted to call out, which was symbolic point in time where the health leadership space is recognizing that the next generation needs to be included and part of this, and where we've seen youth step up to say, look here, there's nothing for us without us. I'll give an example of a country like Uganda, where 70% of the population is under 30 years, but you know, the leadership of many of the aspects, many social sectors, is actually led by people who are above 50. At the Astana conference was that moment when the world was commemorating the 50th anniversary of primary health care, when everything was done and said and the declaration of Astana was produced. The director of the World Health Organization and the president of Kazakhstan got the Astana declaration and handed it to the president of the International Federation of Medical Students Association and said, we are walking the talk. You are the future of primary healthcare going forward. This coming hot on the heels of that is in many ways walking that talk, moving from the symbolic gesture to really bring the action where the rubber hits the tarmac. So I was very deeply honored when I was asked to speak on this moment on a topic that really is so dear to my heart. And as a brief history, I had the opportunity to sit in the organizing committee of the Federation of African Medical Students Association 34th General Assembly and Scientific Conference. And I was deeply impressed that this committee, which had been given a mandate to organize a conference that is a two-day event, was not just seeing it as an end. They were seeing it as a means to the end. They were seeing it as a huge opportunity to generate local solutions for local problems. And they addressed themselves something that is extremely important, something that had been amplified by the moment in time where we are in this pandemic. And it was a breakdown of inclusion of patients in their own care. And they really see this moment to generate momentum, to mobilize students from across Africa to come together and say, how can we henceforth bring our minds, our efforts, our networks, our different sponsors together to generate a movement that will champion this going forward. And it is on that background that at this assembly, a decision or an idea was born to start this patient-centered care movement, Africa, or PaCeM-Afro as it is also known. And I'm glad that we have come this far. With that, I want to thank in a special way the many people that have shown up today to believe in this movement, show solidarity, and also to birth this special network. To that end, I want to particularly thank our moderator today, the distinguished guests, keynote speaker, Dr. Lekata, and in a special way by extension, Dr. Gitinji Gitahi wasn't able to be with us today at Amref University. Professor Faston Goma, we have the president of the Pharmaceutical Society for Students, who's based in West Africa, as well as we have a representative from now. In many ways to say that this is, and sincere gratitude to you all. And finally, to the chief guest, the Minister of Health for Uganda, who will have an opportunity to speak to us at the very end. With that, ladies and gentlemen, take my sincere gratitude and my honor to be a part of this moment. Cheers.